Interesting, isn't it? Though you already know the process so well. Well, looking at that, one could almost get a bit scared as so many people say that high voltage lines are dangerous, and maybe by stimulating our cells so much, there could be a risk.
Actually, it refers to an unending polemic, yet so many studies have shown that actually those high-tension lines don't really affect those living under it. Anyway, it is a polemic, and I don't really want to talk about it here right now. Our machines generate much smaller magnetic waves, which are adapted to the body, calculating according to a frequency compatible with ourselves. There's no side effect, no pain, not even any sensation, or risk of fever from hypothermia. Nothing at all, absolutely. So that's basically the answer to that.
Can you make the difference between this method and what we can sometimes experience during physiotherapy sessions, such as electrotherapy, ultrasonotherapy, or even ionotherapy? All that goes through is electricity. We can feel some tickling. What is the difference between
Actually, all these techniques are not new, you know. They derive from inventions of a great French scholar, Pierre Curie, who started from piezoelectricity, making crystals vibrate and produce ultrasound as well as magnetic fields. There is also the point de Curie, by which, after one reaches a certain level of high temperature, magnetic fields are developed. They're all French inventors, but France sadly made nothing of it.
I know, that's it. I was going to ask you. In Japan, this technique is recognized and used. Why not here in France? Why not here?
Well, it's the French genius, you know. There are many other inventions which have never been exploited. French people tend to invent things and then just lose total interest. You know, these waves, though, that we are using are at the same time waves and corpuscle. That's the theory of de Broglie, who was also a recipient of the Nobel Prize of Physics, just like Pierre Curie. These waves, though, are now not being used for the time being.
At least in therapy, because, well, as you were telling me, when we do an IRM, we use rays,
yes. When we use IRM, we do that to make images, to take pictures of the brain, but not here, not in this instance. Here they are pulsed. It's about the same as those used in MRI, but pulsed according to a certain rhythm, which create waves. They correspond to the waves of our cell and the cell's enzyme. When two waves meet, which have the same rhythm, they tend to amplify their movement. But when an irregular wave meets with another wave, on the contrary, the wave gets disturbed. Thus, well-worked-out waves, when meeting, should enlarge the movement and force the cells and enzymes to work.
To bring back the balance?
That's it, absolutely. We succeed in exciting the enzyme, the cells, and we create the so-called oxido reaction, which is an exchange of hydrogen and electrons, so to speak.
Did you learn about this all from your microscope, or have studies been done about this?
Actually, plenty. A lot of studies have been on this. All these studies, based on French inventions, have especially been conducted in Boston, in Halifax, in Germany and Japan. Machines are mostly produced in Taiwan, since the patent has been purchased from Japan. Taiwan is usually able to manufacture much cheaper and miniaturized machines, you know.
I would like to come back to electromagnetotherapy. Magnetic waves are one thing. Electrotherapy also uses electricity, electric flows. What's the difference?
Well, the electric flow can stimulate muscles, but firstly, it doesn't pulse. Secondly, there is a certain level beyond which it can electrocute you. So it's obviously very dangerous to exceed this level. On the other hand, magnetic waves, magnetic fields, although 6,000 times stronger than the terrestrial field, well, they'll impose a certain working pace, you see.
Does it have a similarity with chronobiology?
Absolutely, indeed. It's just more or less the same.
We've done a TV program on this topic.
That's a bit like chronobiology, indeed. That's correct. Chronobiology will impose a rhythm, a particular undulation, like an oscillator. A kid playing the piano would have an oscillator in front of him. Take the pendulum of a watch. If it becomes tired and doesn't work, with a slight touch, you can make it work again. That is the mechanism behind it. Here it is about waves, electromagnetic, man-made waves.
What about the difference with ionotherapy? I have attended some sessions. One puts wet sponges on different parts of the body and sends electrical current. The idea is to introduce molecules. Is that it?
Yes, to ionize, to introduce indeed positive and negative cells. But they are not pulsed, you know. They're also weak. The body can absorb a certain amount of ions, whereas magnetic waves can penetrate the whole body. As I was saying, when we oscillate the skull, for example, we can hear magnetic waves.
Precisely. What could you hear there?
Magnetic waves. Flows of magnetic waves, which come by pulsing and force the cells, the arteries, the veins, and even the lymph to work. Each neuron will transmit this command without having to go through receptors or the hormones, but directly, straight to the point, without any diversion whatsoever.
It means that for magnetic waves, we're completely transparent.
There are no borders. If I switch on the machine, we will all be absorbed by these electromagnetic waves. However, electromagnetic is nothing new. Ampere was the first to invent it.
All right, so now let's go have a few words with your patient again after the consultation. She's going to tell us about her experience. I'd forgotten to mention earlier that her name is Marie-Claire, and she's suffering from osteoarthritis, and that you've been following her since September. Let's see.
That's absolutely correct, yes.